Hi.
Hi. Oh, how are you?
I'm good. How are you?
I'm pretty good. Or
Right.
can everybody see and hear us? And can you see and hear me, Dr. Teplinsky?
I can, yes.
Okay, perfect. Thank you so much for doing this today. I
Yeah,
know we have a bunch of questions, so feel free to we can, we don't have to go through them all, but um
yeah, I think a lot of them really focus on, kind of the buckets of what do we need to know about signs and symptoms? How can women advocate for themselves
mhm.
when sometimes their symptoms may be dismissed or attributed to other things? So, and I think GYN Cancer Awareness Month is a perfect time to have some of these conversations.
Absolutely, absolutely. Well, hello and welcome everyone. This is our Instagram live. Ask the Oncologist live with Dr. Teplinsky, and I am Aisha McClellan. I'm the Cervical Cancer Program Coordinator at Share. Please share in the comments where you'll be joining us from today. Before we begin, I just want to tell you a little bit about Share. Share is a national nonprofit that supports, educates, and empowers anyone diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and our helplines, please visit our website at sharecancersupport.org. Feel free to submit any questions in the comments. Remember that we cannot give specific medical advice, so please keep your questions general in nature. And I'd like to hand it over to today's guest, Dr. Teplinsky, who will introduce herself.
Hi, everyone. I am a breast and gynecologic medical oncologist, and I treat all of those diseases. I practice in New Jersey at Valley Health System, and I am a clinical assistant professor of medicine at the Icahn School of Medicine at Mount Sinai. And this is a really important topic to talk about, so I think we should dive right in.
Yeah, absolutely. So we have a bunch of questions. If there's anything that you all have that you want to ask, feel free, but we're going to try to cover a ton in a very short
All
period
right.
of time. All right. First, what symptoms should not be ignored?
Well, and I think that, as we think about the 5 different gynecologic cancers, so cervical, uterine, ovarian, and that also includes fallopian and primary peritoneal, vulvar, and vaginal cancers, they all have somewhat similar symptoms versus and some different symptoms. And the issue is that a lot of the symptoms, especially for ovarian cancer, can be really vague and are often attributed to other diagnoses. So, for example, some of the signs and symptoms of ovarian cancer include bloating, loss of appetite, weight changes, feeling full early, and you can see that can be attributed to so many different things. And so, rather than saying, "Well, here are the 5 symptoms that you should, absolutely not ignore," it's what work if something is new. Number one, if something is new, we want to do an evaluation. Okay. And if what you're being evaluated for does not give you any answers and you have persistent signs and symptoms, we want to keep looking for those answers. So, I think sometimes someone may present with, let's say, bloating and weight gain and are told, oh, it's just menopause. Yes, maybe it could be menopause, but we don't want to attribute it to that unless we've done the workup and said, well, what else could it be? What could we be missing? And so starting with imaging, starting with appropriate evaluation. And so just everyone knows when something doesn't feel right. And I urge everyone to continue to push for those answers.
Absolutely. Great advice. Is pelvic pain always a red flag?
Again, it's kind of in that umbrella of
Mm-hmm.
sometimes we
Mm-hmm.
want to, again, what, and let's characterize that pain more, right? Is it
Mm-hmm.
pain every time you get your period monthly, you're menstruating and you get pelvic cramping? That's very different than I've never had pelvic pain and now I have severe pain that's interfering with my quality of life, my day-to-day activity, right? So those are different things. And so thinking about, is this a new symptom?
Mm-hmm.
what's triggering it, what's making it worse, what's making it better, how long have I had it, and that really requires having a physician or a healthcare provider that's going to listen to you, that's going to sit down with you and ask those questions.
Absolutely. Absolutely. Well, so how do you know if bleeding is abnormal?
Great question. So the first kind of, so vaginal bleeding, how do we know? Well, first thing is are you pre or postmenopausal?
Mhm.
So postmenopausal, your periods have stopped. Any postmenopausal bleeding, 100% should be evaluated. This is there's no debate here. Sometimes if people are experiencing the genitourinary syndrome of menopause, a lot of dryness and atrophy of the tissues, you can have some bleeding, but again, we don't want to attribute it to that, because one of the most common presentations of a uterine cancer is postmenopausal bleeding.
Mhm.
And so we want to, and some of the other GYN cancers as well. So we really want to make sure we work that up. If you're premenopausal, here again, is it part of your cycle? Are you perimenopausal and the cycles are becoming irregular? Is it heavier
Mhm.
than it normally was, right? So again, that context is important. If you had breast cancer, are you on tamoxifen, which can cause thickening of the lining, or polyps, or rarely uterine cancer? So we want to work that up. So, all of these things really guide the workup.
I see. I see. Can a pap test detect ovarian or uterine cancer?
So pap test is really a screening test for pap smear is a screening test for cervical cancer.
Mhm.
However, sometimes it does pick up atypical cells, and occasionally you can get a uterine cancer diagnosis that way. But really, the goal of pap test is for cervical cancer screening. With that said, any abnormal cells on a pap smear need to be evaluated. Typically, it is not a screening test for ovarian cancer, again, unless we're seeing significant involvement of the cervix and the uterus from the ovarian cancer, but it's not technically for that.
Right. Right. Okay. What are some overlooked signs people tend to miss?
Well, I think that comes back to the symptoms being vague.
Mhm.
So postmenopausal bleeding, I'm going to come back to the vague symptoms in a second. Postmenopausal bleeding, bleeding with intercourse. Sometimes people will say, oh, it's just dry and it's bleeding. And we don't want to attribute it to that, because new any bleeding with intercourse, postmenopausal bleeding must be worked out. For ovarian cancer, the problem with ovarian cancer is we don't have a great screening test, and most
Mhm.
of the symptoms don't present until someone is at a later stage, and that can include symptoms again of bloating, early satiety, meaning you feel full earlier, loss of appetite, weight changes, and that I've seen attributed to so many different things that
Mhm.
they're vague, and people say, well, I'm just gaining weight, or I haven't been working out as much, or I'm having hormonal changes. And so the goal here is really, if something is new, rather than saying, well, it must be this, get it worked up.
Yeah.
Because have seen so many women that have come in with months of bloating, feeling full,
Yeah.
not eating much, and just attribute it to stress, menopause, lots going on, I'm not
Mhm.
eating the right way. And so it's really important. Obviously, not everything is going to be an alarm the next day it happens, but things that are persistent for about a few weeks, not going away, really want to get in with your doctor.
Absolutely. So, that leads me to, what if your doctor says it's probably nothing? Should I push for more tests?
And that happens, unfortunately, very often in many
Hmm.
cases. And I think that this is really hard. And I've talked about this, that it's it's a vulnerable situation, you as the patient and the doctor, right? It's already a vulnerable kind of, you're in that vulnerable state as a patient. So I think here is where I really recommend being as direct as possible and saying,
Hmm.
saying something like, I am concerned that this could be cancer.
Hmm.
I know that the symptoms of ovarian cancer, for example, can be vague, and I'm worried that some of these symptoms may be a sign of that. Can we do additional workup? So really stating what you are worried about. And I like to ask my patients this too. I'll say, is there something in particular that you're really concerned about? Because I want to make sure we're on the same wavelength, that we're thinking about the same thing. And so being direct is number one. Number two, bringing someone with you who
Yeah.
can advocate for you if you feel like it's not possible for you to do that as well as you'd like in that visit.
Hmm.
So being direct and having someone with you. And if you can't have someone with you in person, ask if you can have someone say, can I conference in or put my family member or friend on FaceTime? They'd like to be part of the visit.
Right.
So just really being very direct and open about what your worries are and what your needs are.
Yeah, absolutely. So who should be getting regular PAP or HPV tests and how often?
So this is, the guidelines for cervical cancer screening have evolved over the years. And rather than doing the whole laundry list here of
Yeah.
exactly when and how often, I would say it's really important to make sure that everyone is regularly seeing a gynecologist and
Mm-hmm.
having that conversation about when should I be doing cervical cancer screening, how often, with
Mm-hmm.
which modalities, because we do pap smears, we also do HPV testing. HPV is the virus that uh, causes a lot of cervical cancer. So there's all these different tests that get done. And so really making sure you're regularly seeing a gynecologist and having the conversation with your GYN about what you should be doing for screening. I will say often.
I think I lost sound.
Did you lose me for a second?
Yeah, I did.
Sorry. I was saying that so we're seeing your gynecologist regularly, but occasionally people stop seeing their gynecologist. Maybe
Mm-hmm.
they had their uterus taken out or their cervix taken out, and they say, I don't need a pap smear anymore.
Right.
It's still really important to be seeing a gynecologist regularly. In some cases, you may not be going every year, and that's a
Mm-hmm.
conversation with your team, but really important that you're getting that pelvic exam, even if you don't have a cervix and you're not getting pap smears anymore.
Mm-hmm. Okay. Okay. What is the HPV vaccine and why is it important?
Well, as we talked about, the HPV virus or human papilloma virus is responsible for a lot of cervical cancer. And so the HPV vaccine vaccinates against the high risk strains of HPV and really reduces significantly cervical cancer rates. And so it's
Mm-hmm.
really, really important, again, talking with your doctor about when you should get vaccinated, what the vaccination schedule is. But there's a lot of people who didn't get vaccinated initially when the vaccine came out, and you can kind of catch up and get it later, even if you're a little bit older. So really important to have that conversation with your gynecologist.
Okay. Okay. Why don't we hear much about vaginal and vulvar cancers?
I think we don't hear as much about them because they're not as common.
Yeah.
They are the most common gynecologic malignancy is uterine cancer. We hear a lot about uterine cancer. We hear a lot about ovarian, cervical cancer. Vulvar and vaginal cancers are kind of just much less common, so we don't often hear as much about them, and that's really the main reason.
Okay. What's one thing you wish more patients knew before walking into your office?
Hmm. I would say I'm going to change that question a little bit, and I'm going to
Okay.
say what's one thing I wish more patients knew about, and
Okay.
that is your cancer risk. I think this is so important. Knowing, and a lot of times people say, well, I don't have a family history of cancer,
Yeah.
okay? But that may mean making sure that when we think about family history, we're thinking not just mom and dad, but we're going multiple generations, first, second degree relatives, number one, that's important. And really, did anyone in your family get genetic testing? A lot of times people come from families when people aren't talking so much about family history. And
Mm-hmm.
so it's really hush hush and we don't know the full story. But family history alone is not the only risk. And so
Yeah.
really knowing what cancers are you at risk for, because that can then guide, and this is not just gynecologic cancer, this is any
Mm-hmm.
cancer, you know, that can then guide what screening do you need. Sometimes I see people who've been diagnosed with uterine or ovarian cancer that do have a genetic mutation, but no one in their family and no one in their medical team talked to them at length about their family history and did genetic testing. So what I wish everyone would know and would say to their healthcare team is, can we talk about my cancer risk? Based on
Mm-hmm.
my family history, and my medical history and my social history, my smoking, alcohol, things like that, what cancers am I at risk for and what should I be doing? Because one of the
I
things what we
see.
really don't want is, if we know someone is at risk for ovarian cancer, can we do things earlier to reduce their risk to prevent a diagnosis, right? That's the ultimate
Right.
goal.
Mm-hmm. Mm-hmm. So how can you get genetic testing like BRCA?
So genetic testing is testing for the BRCA gene mutation is just one component. We now test for a whole panel of different genes, including things like Lynch syndrome, which increase the risk for uterine and colon cancer. And there's a couple of different ways to get genetic testing. There are a lot of great organizations that do genetic testing, but I always start with your doctor and asking them
Mhm.
to refer you to a genetic counselor and a genetic screening program. But there are a number of organizations. The Wisdom Study is a clinical trial that is looking for breast cancer screening but provides free genetic testing.
Okay.
There's another organization, Get J Screened, that you can go through. So there's a number out there, but I think starting with your healthcare team is the best. One thing I would say is be very careful about some of the direct-to-consumer genetic tests,
Mm.
like 23andMe or Ancestry. I know that things are changing there, but because those are not sequencing the entire gene, and so
Oh,
you may get false information thinking you're negative when you're not really negative, or vice versa. So just
makes
be
sense.
mindful of where you're going for that genetic testing.
Okay, okay. Um, can lifestyle changes lower risk or is it mostly genetic?
No, it's, many cancers or most cancers are not genetically driven. So I think that's an important point. Lifestyle is really, really important. And I think one of the things that I'm really encouraged by is that we're starting to see more research into exactly how lifestyle can lower risk. And that really helps us because we can provide great scientific information to our patients. But exercise, medicine is, movement is medicine. And
Mm.
moving, getting out there, starting with walking, lifting weights, all of that is so, so important. It reduces cancer risk 100%. I mean, there's data for this. Number two, limiting alcohol use, alcohol
Mhm.
or eliminating alcohol use as well. We know that there's no safe amount of alcohol that no safe amount of alcohol in terms of cancer risk. And so the less you drink, the better. Alcohol is responsible for many different cancers, or not responsible for, but contributes to the risk of many different cancers. And, thinking about what we're eating, limiting ultra processed foods, focusing on more plants, more fruits, vegetables, lean produce, lean protein. All of these things are so, so important.
Yeah. I didn't see that we had a few questions come in live. I don't know how much more time you
I have a
have.
few more minutes so we can
Okay.
tackle
All
a
right.
couple.
Okay. So, do you think the do you think the COVID vaccine includes reaction, the inflammation that is aiding MBC?
Well, we have no data for this at this
Mm-hmm.
point. We actually, there was a study. It was a preclinical study. It was in mice, where they found that severe kind of COVID or flu infection of the mice caused dormant tumor cells in the lungs to grow, and so that was with the actual virus, again, in mice, and there's a lot of caveats to that, so we can't really say, but we don't have data at this point that anything about the vaccine causes cancer to grow, but we do have this preclinical data that COVID infection may have some sort of contribution, but again, that data is very, very preliminary and very nuanced at this point.
I see. I see. Um, I had triple negative breast cancer. What testing should I be having?
Um, so That's a great question. And that's hard to answer, right? That's a very individualized thing. It
Yeah.
depends, okay, what stage, what treatment did you receive? Is there anything that we're monitoring? So I think that those are really individual discussions, but it's a great question for your medical team. The one thing that I do want to say is that everyone who has finished cancer treatment should get a bone density scan,
Yeah.
because cancer treatment, chemotherapy can weaken our bones, and so knowing what your baseline bone density is really, really important. And I find that a lot of people don't have that done.
Gotcha. Okay, so we'll just end with a couple, just I guess two things. I would say, what advice would you give someone who feels scared about getting tested for anything or waiting on those results?
I completely understand, right? This is really scary. These are often life-changing tests, and it can be really hard. Knowledge, though, is power, and we can act on things, and there's a lot that we can do. And so, recognizing yes, I'm afraid. Yes, I'm fearful. And this can help my life, my family, can be really, really powerful. But recognizing that these emotions are okay, and
Hmm.
hopefully working with a healthcare team that you trust and having, a friend or a family member to help guide you through some of it.
Okay, last question. There's a lot of, a lot of talk around Breast Cancer Awareness Month in October. How can we, maybe get to the same level when it comes to GYN cancers, or how can we get more people talking about it?
Yeah, I think that's a great question. And you're right. I mean, September should be this big month. We should be seeing teal
Right.
everywhere, and
Yeah.
we don't. And so
Hmm.
I think the more we talk about it,
Hmm.
it's important. I think when we think of numbers, right, breast cancer is just more common. So I think that's part of that.
Sure.
But we need to talk about it because we need more money for research. We need more funding for drug development and clinical trials. And so I think that having more people share their experiences is really important. That power of storytelling, conversations like this one, getting it more into the public eye is really important. And the more we talk about it, and I think it will also empower people to advocate for themselves to get right, because with Breast Cancer Awareness Month, I mean, one of the goals is to get people to go, get their mammograms and get their
Yeah.
screening. So the same thing here, right? What is our goal? Funding, but also to help people figure out, what am I at risk for? What should I be getting? Let me see the gynecologist, right? Taking action.
Absolutely.
So I always like to think of it as Awareness and Action Month.
Yeah. Yeah. I love that. Well, thank you so much, Dr. Teplinsky, and thank you to all of you for participating and submitting your questions. I tried to get through as many as I could, but definitely keep the conversation going with your providers,
Mm-hmm.
and you know, also check out our upcoming educational programs and support groups, which are pinned in the chat. You can also follow us on social media, and thank you so much.
Thanks for having me.
Yeah, this concludes our Instagram Live, and I'll talk to you all soon.
Okay, take care.
Thanks. You too.